So the MAIN-CAV was I presented the MAIN-CAV study, which is a phase 3 randomized study that I'm leading through the Alliance Cooperative Group through the NCI. As we know that based on JAVELIN Bladder 100 study, frontline platinums followed by Avelumab maintenance in patients who do not progress is the current standard of care because it improved survival compared to best supportive care alone. However, if we tease out the data from that, we see that patients with visceral metastases don't derive as much benefit from Avelumab as those who have non-visceral metastases like lymph nodes. So we wanted to see if intensifying the maintenance therapy can further improve outcomes beyond Avelumab. So this study is a maintenance study where patients with locally advanced or metastatic urothelial cancer, including N3 disease, and they could have received any platinum, gemcitabine, carboplatin, gemcitabine, cisplatin, MVAC, dose-dense MVAC, at least 4 to 6 cycles and not progressed on that. And they would be randomized to Avelumab versus Avelumab and Cabozantinib. As you know, Cabozantinib is a VEGF TKI, and it has been combined with other checkpoint inhibitors in refractory bladder cancer with good activity, and we thought this would be a good partner with Avelumab. And there's preclinical data on complementary activity of these two agents as well. So this is a 654 patient study. Primary endpoint is overall survival. We have limited the study treatment to up to 2 years, as opposed to JAVELIN, where there was no end date for the treatment. So this study is still ongoing. It is active across a lot of sites in the US and in Canada. So there's no results to share at this point, but this was a trials in progress. Thank you.